Hi guys, it's me, Professor Dia. Welcome back to my YouTube channel. On this video, I'm going to be going over pediatric growth and development as well as social influences on the pediatric patient. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and give it a thumbs up now. Subscribe to my channel if you haven't done so already. And don't forget, I'm now offering next generation NCLEX review sessions. You can reserve your spot for both part 1 and part 2 by going to my website, nexusnursinginstitute.com. If you're a current nursing student, you're not even studying for NCLEX, you're just trying to survive the program, I've got something for you as well. Be sure to check out my audio lessons by, again, going to my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, and Facebook. My handle's the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Social influences on the pediatric patient. First question, which parenting style exerts little or no control over their children's actions? Would it be authoritarian? Would it be permissive? Would it be authoritative? Or would it be non-limit setting? Which one is the one where there is little or no control over the children's action? The correct answer is permissive. 18 of you guys chose non-limit setting. I made that up. That came right out of my brain. There is no such thing, okay? So it's permissive. Permissive style is where you just let the kid do whatever they want. There is really no discipline. There's no control over the behavior. Now, let's talk about authoritative. Authoritative is complete control over the behavior. It's very controlling. You don't even give a rationale on when you're telling the child what to do. If you tell them to stay away from the stove, they need to stay away from the stove because you said so. You're not even explaining why. Authoritative is kind of a mix between the authoritarian and the permissive. Okay, so with authoritative, it's a combination where rules are set, but it's much more lax, and there are explanations on why and the rationale. Okay. All right, type in your answer. Should expected behavior be reviewed with the child before or after a special or unusual event? Before or after? Type in your answer. Should expected behavior, your expectations of how the child should behave, should that be reviewed with that child before or after the event? What do you guys think? Before. And the reason it's before, it's not fair if you don't provide your expectations on behavior. And then when the child does something that they shouldn't have done, that they didn't know that they shouldn't have done, when they're doing it, that's when you want to correct the behavior or even punish them or even afterwards. So what happens is you want to do it beforehand, because here's what happens. If you wait when the child starts acting up and you tell them to stop, and if they stop, you'll give them a treat. Guess what? That's bribery. It's bribery. But if you talk about your expectations beforehand, so before they go to the zoo or before they go to that birthday party, you tell them, okay, this is how I want you to behave. And if you behave, when we get home, you'll get a special prize. They have an incentive to behave, and you haven't bribed them. You didn't teach them to misbehave just so that you would bribe them to behave later. Okay, so it's before. Very good. True or false? When reprimanding children, the focus should be on the child and not on the behavior. Is this true or is this false? Very good. That's false. When you're reprimanding a child, you're not reprimanding that child. Oh, you're a bad boy. You're a bad girl. You never say that to the child. That sticks with them. No. What you're upset about is the behavior, not the child. You don't want them to internalize that anger and feel like they're a bad person. Their behavior may have been wrong. Something they did was wrong, but them themselves, they're not wrong. So you're going to focus that when you're reprimanding the child, you're going to focus on the behavior and not the actual child. All right, type in your answer. A rule for the length of time out is how many minutes per year of age. So what's the rule of thumb? When a child's going into timeout, how long should they be in timeout? What's the rule of thumb? How many minutes per age? What do you guys think? Two, 30, 20. It's one. One. 1 minute per year of age. Because, anything more, they're going to forget, right? So if it's a 3-year-old child, you're going to put them in timeout for 3 minutes. If they're 5 years old, you put them in timeout for 5 minutes. If they're, 4 years old, you put them in timeout for 4 minutes. Because here's what happens. You have a 4-year-old, you put them in timeout for 20 minutes. By the time they've been in timeout for 20 minutes, they already forgot what they did wrong that they were in timeout for. Okay. So 1 minute per year of age is appropriate. True or false? Let me move this. To estimate how tall a child may be as an adult, you're going to triple that child's height at the age of 2. Is it true or false? When you're trying to figure out approximately how tall the child's going to be. At 2 years old, you're going to triple that height. Is that true or is it false? Very good. It's false. All right, you guys on the live, do you know what number? What are we going to do? You're going to double it. So if you want to figure out approximately how tall the child's going to be as an adult, at the age of 2, you're going to double their height. And remember, guys, this is an approximate. According to Freud, in which stage of development is there interest in the anal region as the sphincter muscles develop? Is it the oral stage? Is it the anal stage? Is it the phallic stage? Or is it the latency period? Very good. Most of you guys got it right. It's the anal stage. And I gave you guys some clues in the picture, the little baby with the toilet paper. And in the question, it says the sphincter muscles, anal stage. So what happens is in this anal stage, this is around the toddler stage. So they're 1 to 3 years old. This is where they start to develop control over that sphincter muscle. So this is around the age where we start what? Potty training. Okay. Oral stage, that's about birth to 1 years old, and that's the stage where that infant finds enjoyment, pleasure through the mouth. That's why they like the no, I'm saying it wrong. What do you guys call it? Pacifier. That's why they like the pacifier, and they get joy from feeding, right? So that's the oral stage. And then you have the phallic stage, that's 3 to 6 years old. This is when the children become interested in the genitalia. And this is not something that's sexual. They just have a curiosity. This is a stage where they start to tell the difference between the boy and girl. And then, of course, you have latency stage or latency period. This is a school age. This is around 6 to 12 years old, where, the skills that child learned in preschool, they bring it on into regular school and they're learning. But how are they learning? They're learning through play. They're learning through activity. Okay. All right. Type in your answer. What type of play is seen when children play independently but among each other? There is no group association. What is the name of this type of play? So it's a type of play where children are playing independently by themselves, but they're still playing side by side. There's no group association in this play. What's this type of play called? Parallel play, solitary, nope. Cooperative, no. Parallel play. So in the parallel play, we see this among the toddlers. The child is playing independently by themselves with their own toy, but they're playing with another child who's playing by themselves independently with their own toy. This is what's known as parallel play. There's no group association. They're not playing with each other. All right, I need you to put this list in order for me. List the type of play in order of age from youngest to oldest. How would you put this in order? So if you guys are on the Kahoot, go ahead and move your mouse and put these in order. From youngest to oldest, how would you arrange it? All right. Well, 32 of you guys, oh, well, 13 of you guys got it right. Okay, so let's talk about it. From youngest to oldest. So at first you have solitary play. We tend to see this in the infants, birth to 1 year. So you do what? You give them a rattle or something, and they're just playing by themselves, solitary play. They're not worried about anybody else. It's just them and their toy. No one's next to them. And then you have parallel play. These are the toddlers around, 1 to 3 years old, maybe even 4 years old, where they're playing with their toy, but they're playing with their toy next to another child that's playing with their toy. That's the parallel play. Then you have associative play. That's your preschooler, right? The associative play, they're playing together, but there are no rules. There's no leader. There's no organization. There's no goal. They're just playing. They're running around. It's very loose play. Then you have cooperative play. That is a school age child. They understand rules now, right? So there are rules. There may be a leader of the play. There's a goal, and the goal is to win. It's very organized, right? And they're playing with each other. So you go from solitary, parallel, associative, and then cooperative. Very good. How are you guys doing on the live? All right, next, put this in order, please. List Erickson's psychosocial stages of development in order. Which comes first, second, third, fourth? Go ahead and list Erickson's psychosocial stages of development in order. We have initiative versus guilt, industry versus inferiority, trust versus mistrust, and autonomy versus shame and doubt. You guys are doing great on the live. Okay, good. 20 of you guys got it right. First, we have trust versus mistrust. That's around, birth to 1 years old. Then we have autonomy versus shame and doubt. That's 1 to 3. That's the toddler, right? That's where they want to start doing things for themselves. Then you have initiative versus guilt. That's 3 to 6. And then you have industry versus inferiority. That's around 6 to 12. And there wasn't a space for the last one. The last one is what is the last one, guys? Who remembers on the live? I'm having a brain fart. Identity. Identity versus role confusion. And identity versus role confusion, we see that around 12 to 18 years old. That's, the adolescent stage, and that's all about identity, figuring out who they are. Here's the thing you guys got to know about that stage. They figure out who they are through their peer group. So when it comes to the adolescent stage, the most important thing to them, to the adolescents, is going to be their peer group, because that is who they figure, that's how they figure out who they are, through their peer group. So this is the order. Very good. All right. In which stage of Piaget's cognitive development theory would you expect to see the concept of conservation? Which stage would you expect to see the concept of conservation? Would it be in the sensory motor stage? Would it be the pre-operational stage? Would it be concrete operational stage? Or would it be formal operational stage? Very good. Concrete operations. So what is concrete operations? In the concrete operation stage, that child starts to understand that weight, height, volume, it remains the same despite what it looks like, which means if you put 10 milliliters in a container that's tall, right? That 10 milliliters will still remain to be 10 milliliters if you put it in a container that's smaller or shorter. Okay. That's what's known as conservation. And we see that in concrete operations. Now, sensory motor. And sensory motor, that's where the child develops object permanence. And object permanence is when the child realizes an object is still there, even if it's hidden. So if you take their toy and you hide it behind the couch, if they crawl to go look behind the couch, that lets you know they realize the toy didn't disappear. The toy still exists. So that's why they're looking behind the couch. That's object permanence. Now, the next stage, pre-operational stage, that is where the child is very egocentric. Let me tell you something. During this stage, they have egocentrism. There is no point of asking that child, like if they do something wrong, they take little Johnny's toy. There's no point of saying to that child, how do you think little Johnny feels? Guess what? They can't think about it. They can't even imagine someone else's point of view because they're egocentric. They view their world, their environment only through their eyes, from their point of view. So when you're teaching a child in the pre-operational stage, you have to teach them from their point of view so that they'll understand. And then formal operations, we're dealing with that older child, we're dealing with that adolescent where they can think what? They can think abstractly. An object doesn't have to be in front of them for them to think about it. It doesn't even have to be an object. They can think about choices that they make and the possible outcome. So we have that teenager that's grounded and they're thinking about sneaking out, right? They can think about all of the outcome, everything that can possibly happen if they sneak out, if they get caught, what kind of punishment is down the line before they make a decision. So that's being able to think abstractly. So in formal operations, one of the major milestones is abstract thought. All right, last question coming up. Type in your answer. Which cranial nerve would you be testing if you were to have a child close his or her eyes and identify an odor, such as chocolate or orange or alcohol? So they have to close their eyes and they have to identify that odor. Which cranial nerve would you be testing? Type in your answer. Congratulations, Wani, on passing your NCLEX. Congratulations. That's right, olfactory, 1. Cranial nerve 1, also known as the olfactory nerve. That is what you would be checking for. You guys did wonderful. Let's see who won this Kahoot.